Hi, Dr. James Bullock here. I'd like to talk with you today about meniscus tears, and we've done a previous video with some educational content about meniscus tears, but today I wanted to talk specifically about two kinds of meniscus tears. First is a meniscus root tear. So the meniscus, which is this tissue, which is a fibrocartilaginous type tissue, which adds cushion to the knee joint. You have a medial, an inner, and an outer meniscus, which is called the lateral meniscus. So the meniscus is anchored into the bone at the back of the knee. That's what's called the posterior root, and at the front, the anterior root. Around the periphery of the knee, it's attached to the capsule, which is called the meniscocapsular junction. So those attachments stabilize the meniscus. So if the meniscus is supposed to function as a shock absorber and a stabilizer of the knee, if there's a tear in the meniscus, it can compromise that, and that can lead to increased stresses on the cartilage and the bone, and can even cause some instability type symptoms. There is a specific meniscus tear called the root tear, which can act like a really bad silent actor, in the sense that patients oftentimes don't recall a specific injury episode, and they can have pain, swelling, discomfort in the knee without the classic symptoms of feeling like there's a flap of meniscus tissue that's moving around and getting stuck. It's often seen in a middle-aged population patient who's active but not always involved in sports. And it's really important that your orthopedic surgeon has an eye out for this, because if a meniscus root tear is not appreciated, then it can cause rapid deterioration in the joint, specifically lead to early onset arthritis, which can accelerate at a rapid rate. The specialist really needs to have an eye out for this based on the history, but also even in reviewing MRIs, meniscus root tears can be missed even by trained radiologists. So that's why personally I look at MRIs myself and don't just rely on the report, and that's why we always ask you to bring the MRI in so we can look at it. So how do we address a meniscus root tear? If the patient doesn't have severe arthritis as well, and we think that there's a role for us to preserve the joint, we do what's called a meniscus root repair. So what we have to do is arthroscopically, so through small poke hole type incisions with a camera in the knee and instruments that can access it, what I do is we go in and we pass suture through the meniscus at the site where it's torn off from the bone. And we have a video model which will show you what the root tear looks like and what a repair looks like. So here in the medial compartment, we did a little cleanup of the cartilage. We have some chondromalacia because this has been chronic. Some free edge meniscus tearing, but nothing at the meniscocapsular junction there. At the root, we've got a problem. It might look like it's okay, but this is more so just synovial capsular type tissue. The actual root is here, and it needs to go there. So that's why the meniscus really has no integrity, because this root needs to come into this spot, okay? And when I let it go, you'll see the change in the tension versus when I pull it in, let it go, pull it in, right there. All right, good. All right, so it's been reattached. It's bleeding from around the site. Let's look at it from this portal. Get a better look. Nice attachment. And we also put a suture in across the meniscus into the capsule to help stabilize. Nice tension and reduce. So we pass some sutures through the meniscus torn portion, and then we make a small incision over the side of the knee, the upper part of the tibia, the shin bone, and with special guides, we make a small drill path to where the meniscus is supposed to be attached to the bone. We then utilize a little shuttling lasso suture to pull that down, and then we anchor those sutures into the bone with a small anchor or tie it over a special button. Several ways to fixate it. So we're reattaching the insertion. So the idea behind this whole philosophy is, you know, a chain is as strong as the weakest link. If your meniscus root is torn, the meniscus is dysfunctional, and instead of being a nice shock absorber, it basically gets pushed out of the way, and there's more contact between the bone and cartilage. So meniscus root repairs, if caught in the right timeline and done in the right patient, can really have a significant impact on limiting the chance of someone developing rapid onset arthritis. So now to discuss specifically really large meniscus tears or patients who have had prior meniscus surgery and it hasn't gone well. There are a subset of patients that come to me who are still relatively young and active and do not have arthritis in the knee, and they've had a long-standing meniscus tear which has been neglected, or they've had prior meniscus surgery where it's been trimmed out essentially, and they don't have a lot of meniscus volume. So instead of being a nice, large, robust meniscus which can provide cushion for the joint, that's gone. And so what will happen is there's increased stress on the cartilage and bone, and that can lead to pain with activities and to arthritic changes. So in those situations, a meniscus cleanup is not going to help, or a meniscectomy, it's going to further reduce the meniscus volume, and there's not enough tissue available to do a repair. The option in that particular patient, if they don't have any real bad bony alignment issues and they don't already have significant arthritis, could be a meniscus transplant. And so that's done with what's called allograft tissue, so cadaveric donor tissue, which is obtained from reputable tissue banks in our practice in the systems that we do these surgeries. And we basically make small poke hole incisions to introduce the cadaver meniscus tissue in, and we attach it at the root, at the front and back of the meniscus and around the periphery with special tools which we have available. And that can significantly decrease the stress on the bone and cartilage in that compartment. And if the patient is compliant, allows it to heal and gradually increases activities, can really restore function and decrease pain. And so that's an option to help preserve the joint and avoid the need for an early joint replacement in a younger person with a deficient meniscus.